uh, what we can do after Dominic's talk is put some of this into action. We have people here from the government. We have our two of our board of supervisors are here, the county manager, the assistant county manager. We have educators here, principals from different schools. We have leaders from the religious communities, different churches, and we have first responders and policemen here. We even have bikers against child abuse here, so thank you for coming today. All right, our next speaker, Dominic Cappello, went to Long Beach State, and he has written a bestseller book called Anna, Age 8, and he's an expert on childhood trauma and how it manifests itself in adulthood. He's made it. He's been on Oprah. And he also, perhaps most impressively, was Captain Hook in the Disney production at Disneyland, the original one, when he was in school to help him get through school. So the original Peter Pan. Dominic, with no further ado, thank you for speaking today.
All right, I don't think I've ever been introduced as both Captain Hook and Peter Pan before this topic, but maybe it's good we have a light moment. What I'm about to talk about is going to be a very tough conversation for you. And before I start this conversation, which is a story about Anna, age 8, and making sure that her story is not repeated in Arizona, I'd like you to all stand up. So what we're about to talk about is going to require a lot of courage and compassion. And so what I'd like you to do is just take one deep breath in and out. And if you need to during my talk, stand up, go to the back of the room, do whatever you need to do, but I'll be talking for a bit. But then we're going to be very interactive, and you're going to be up and doing things because Anna's story requires action. So please have a seat. So Anna, age 8. Institute at Northern New Mexico College. What I'm about to share with you is kind of an amazing and inspiring story, and it's really a story of hope that followed a very tragic story. And the book, Anna, Age 8, The Data-Driven Prevention of Childhood Trauma and Maltreatment, was started with my colleague, Dr. Catherine Ortega-Courtney. We were working in a basement. We were working two floors down in Santa Fe, New Mexico, in the child welfare office. And when you work in child welfare, we were working in the Research Assessment and Data Bureau. So we were not in the field. We were collecting the data. And I think most of you know that in child welfare world, you do not move a child from a home to a car, to an office, to a foster parent. There are no moves without reports. Everything is logged. Child welfare probably has more data than any group in the United States because every movement of a child, every meeting with a child and their parent is recorded. So we knew in New Mexico, from all 33 counties, the county offices pouring in reports, who's being investigated, who's being substantiated, who's in foster care, who's up for adoption. Will parents be able to reunify, or will we terminate parental rights? So that was our life, that was our job. And when you work in child welfare, you dread the day, but you know it's coming, of the high-profile report that comes out in the news. It could be a horrendous case of abuse or neglect, but sometimes you hear about the child fatality. You hear about the child who didn't make it. And of course, when that happens, the news comes in, and they want to point blame very quickly. And so this was just another day in the basement. Catherine and I are working, and then the news came in that a little child had been killed. And it was another very sad afternoon. But this case was a little different than most. And we were so mortified by this case that we then and there committed to write a book about how this could have happened. And we call the child Anna. It's not the child's real name. We changed the name to protect the family. But Anna's based on a very, very real child. And that child could easily live in this community. It just so happened it was in my community. But the story caught the attention. The story caught the attention of not only the news cycle, but of course the state lawmakers and the governor. Mortified. How could this happen? And that led to us committing to the book that took a few years to write, and also getting the book out and released a year ago, and making the decision that it would be made available to free to anybody who wanted it. And eventually it caught the attention of a state senator. And I'll tell you more about that story. But there was in New Mexico real interest in the book, real interest in Anna's story, real interest in making sure that never happened again. And it led to a Senate bill with bipartisan support funding the Anna Age 8 Institute, which will be at Northern New Mexico College. So there's a longer story there, but I'm telling you kind of the story all up front to know that there was an incredible tragedy that led to people just like you deciding enough is enough. Getting the word out there to people just like you in a room just like this, getting the attention of some pretty powerful lawmakers who said, we need more than a book, we need a strategic plan. We need more than workshops, we need more than conferences. Now, don't get me wrong, we need all of you educated, and Dr. Stam has done an incredible job. You need that information, but if we stop there, we don't get anywhere. It's time to take big action. So what I'm going to propose to you is unlike anything you've probably ever heard, because we have to do things very, very differently, or there will be more Annas. But the good news is in our state that we've made a huge commitment with the funding of this institute. And I've come here because I've been invited by people from Arizona who said, well, if New Mexico is going to try this, we should at least present the model to people in Arizona to see, do you want to take this model on? So let me tell you a little bit more about Anna. So Anna, it was reported that Anna was in trouble in her home, and so an investigator went out, as they do, evaluated the house, and determined that she was not safe. So they took Anna out of the house. So now Anna's in custody. And then they determined that it was okay to put her back with her mother. Her mother had a very long history of mental health challenges, violence, and substance misuse. But they determined she would be safe. So Anna went back. And then another report. So Anna was pulled. And then they determined Anna would be safe. We're up to 2, right? 3 times, 4 times, 5 times. The 6th time, pulled. She's not safe. We've determined she's safe now. 7 times, 8 times. And of course, this won't surprise you. When she finally went back, her mother kicked her to death. Who could be surprised? 8 times? Wouldn't you think by the 3rd report there's something pretty wrong in that house? And that mom's in serious trouble. And Anna is in real trouble. So Catherine and I thought long and hard about this and thought there's just so much wrong on so many levels. And so we decided our book will be an expose of child welfare. We're really going to expose what happened here. Now, we love our coworkers in child welfare, and it wasn't our intention to point fingers at them. They're some of the hardest working, most caring people on the planet. But the system is totally broken. It doesn't work. And I spent a lot of time working with other child welfare systems, working to improve their system, but I can tell you, from New Mexico to New York City to Connecticut to Pennsylvania, it's the same thing. Noble-hearted people working in a system that does not keep our children safe. And people often think, why doesn't child welfare work differently? I mean, it's their job to protect them. They should be preventing things. Child welfare is not paid, and has never been paid, really, to prevent. Now, they will have some programs called prevention, but they are not set up to go into the community, to go into your community, and to make sure all the services that must work are working. It's not their job. But let me tell you, when there's a child death, the fingers, they're pointed at child welfare. So Anna's story is horrific, but stories like Anna are happening every day, not as dramatic. But does it really matter that it was 8 times, 3 times, 2 times? So when the book came out, and this book, I should say, was not the one that got on Oprah. That's an earlier book. But thanks for that plug anyway, Judge. And I can tell you some Oprah stories if you want to hear them later. But this book didn't get that kind of attention. I should tell you that when we were writing the book, I contacted my editor, who did publish 3 of my books. Wonderful woman who really likes me, thought the book was incredible, super important. And she said, you know, I've looked at your proposal and I've read your first chapter, and, you know, it's so important. Everyone should read this book. However, you know, Dom, you and Catherine, you've got these great stories about Anna, and they're horrific. Could you get more of those stories, of other horrific stories? Like, why don't you do the book just about really horrific stories? Because America will buy that book. But your book is about solutions and talking about policy and programs, and you know, that's like a government book. No one's going to buy that. So Dom, if you change it, I think we can publish it, get you back to Oprah. Wouldn't that be great? And Catherine and I, that's not why we're writing the book. In this society, our mobile devices and our TVs give us horrific stories 24/7. I don't think you need more horrific stories about children at risk, do you? It's too much. It's just too much. We've become numb to the torture, abuse, and neglect of our children. We all feel it's terrible. We all do. The moment I said it, you thought, that's terrible. But then we want to know, can we just get to the next Starbucks, you know, and hang out? I mean, our brains, in a way, can't take it on. And my theory, and many other people have a theory, and Dr. Nadine Burke, who was referenced, shares the theory. Why don't we adults, why aren't we engaged in this conversation much more in doing things? It's painful to think about this. And we don't want, our brain does not want pain or sadness. We want that warm latte. We really do. We want that comfort. And we have to stop that. And we're going to stop it, as a matter of fact. Sorry, I meant to say that when the book came out, I got a call about just a week after the book came out. It did get a lot of attention in New Mexico, and so I got a call at 9 o'clock on a Saturday night, actually, from Cassandra Gondara, who was a city council person in Las Cruces. And I had known Cassandra years earlier because she had worked in child welfare before she retired and ran for office and won. And she's calling me and she's saying, Dom, I just finished Anna age 8. I go, that's great. How was it? It's fantastic. It says at the end to call you, get a hold of you, to start doing the work. So I'm calling you right now. I go, okay, Cassandra, that's great. 9 o'clock on a Saturday night, that's cool. I go, do you have funding to start a significant project? She says, I just finished the book. There's no funding. I mean, I'm just ready to go. I go, well, can we get funding? She goes, I don't know. I don't think that should matter. We should just start doing what you said to do. And I thought for a minute, and I thought, she's absolutely right. Why should we wait for money? Yes, we're going to need money. Yes, we're going to need staff. Yes, we're going to have to do the things you do when a community decides to commit to take care of their children. But should we be waiting for permission to start that process? No. So I said, let's go. So she started. So she did, she put out the call, and she said, well, who do I invite? I said, well, if you've read the book, you know that we talk about 10 sectors that have to work. You know the sectors: behavioral health care, medical care, housing, food, shelter, the basics, moving on to quality schools, early childhood learning, youth mentors, jobs, job training, parent supports. I go, why don't you just invite all the leaders of the agencies who do that work in your county? So she did, and she thought, Dom, maybe we'll get 20 people. You know, that's a good start in Las Cruces. And so I came down, and we had about 45 people had shown up. And so that started the work. And I'm going to tell you more about what the work is. As a matter of fact, you're going to start doing the work in just a bit. But my point is this. She just read that book, and she said, I could not call you. I mean, I know I should have waited till Monday, but I just felt like I had to start this because enough is enough. So that started, and as I mentioned, well, there were some incredible people. So the next call that came in, was an email from Dr. Richard Bailey, who is the president of Northern New Mexico College, which is about 30 minutes north of Santa Fe. And it's in the county of Rio Arriba. And Rio Arriba has been known for a long time as having the highest drug overdose death rates in the nation. They're either number 1, number 2, or number 3. I mean, think about it. An epidemic of substance misuse. People literally die in parking lots overdosing. It's a very, very sad environment to grow up in. But this college is a beacon of hope. And so we met with Dr. Bailey, and Catherine and I, we always feel like we have to go into a meeting and sell people. Like, I sort of feel like I have to sell you on making sure our kids are safe. And it's just the nature of the beast of our work. But we got in there, we didn't have to sell him. He was ahead of us. He held up the book. This is a campus issue. 3 out of 4 of my students do not make it through our programs. I am convinced it has to do with trauma. And I know we have to be doing work on this campus. And I know we need to be a beacon of hope for the city and the county. We've got to start the work. Tell me how we do it. Catherine and I left that meeting like, what just happened in that meeting? I mean, how often does a college president do that? So it was pretty powerful. And he says, let's start thinking about how we're going to set this up on a county level, and we're going to be in charge of it. We're going to work with you. We're going to turn your book into reality. And then Senator Souls from our state called me one night. I get these people work during the day. They call you at night. He says, I've got to meet you for dinner. I really need to I want to talk about your book and something that happened. And so I said, of course. So he says, I gave the ACEs survey, the 10-question survey, to my students in my advanced placement psychology class in high school in Las Cruces. And I tabulated anonymously, and I got it back. And this was part of just us talking about as a psychology class, why they need to know about it. But they were comfortable doing it, and so we got the results. And you're now holding what we gave them. If you look in your packet, do you all have the ACEs survey. It says, what percent are safe from trauma? So this is what Senator Soules asked his high school students. And 1, did a parent or other adult in the household often or very often push, grab, slap, or throw something at you, or ever hit you so hard you had marks or were injured? Imagine answering yes to that. You know, we want our kids to do their math homework. And that's what's happening to this kid, little Jenny, little Joe. 2, did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? Imagine you're a high school student and you've answered yes to those first 2 questions. Their math homework, right? Why wasn't your homework done? Why are you slacking off in school? Why don't you concentrate more? And little Jennifer's answered yes to those 2. 3, did an adult or person at least 5 years older than you ever touch or fondle you, or have you touch their body in a sexual way, or attempt or actually have oral, anal, or vaginal intercourse with you? I mean, really? Little Susan answers yes to that, and we're upset because she's acting out in the classroom. Imagine you've answered yes to these 3. 4, did you often or very often feel that no one in your family loved you or thought you were important or special, or that your family didn't look out for each other, feel close to each other, or support each other? So now little Philip has answered 4. And we wonder why he starts fights at school. It's probably going to drop out. Do we really have to wonder why these kids are acting this way? And I know that these questions are hard, because it's about our lives too. 5, did you often or very often feel that you didn't have enough to eat, had to wear dirty clothes, or had no one to protect you, or your parents were too drunk or high to take care of you, or take you to the doctor when you needed to go? These are forms of neglect that are happening everywhere, in this community, in my community, across the nation. 6, did you live with anyone who was a problem drinker or alcoholic, or who used street drugs? 7, was your parent or step-parent often or very often pushed, grabbed, slapped, or hit by a thrown object? Or sometimes often or very often kicked, bitten, hit with a fist, or hit with something hard, or ever repeatedly hit for at least a few minutes, or threatened with a gun or knife? Imagine kids answering yes to these 7 questions. 8, was a household member depressed or mentally ill, or did a household member attempt suicide? Yes or no? 9, were your parents separated or divorced? 10, did a household member go to prison? So this is what Senator Soules, Dr. Soules, asked his high school students. 3/4 of the students had 3 or more ACEs, many with 5, 6, 7, 8s, 9s, and 10s. He thought this class must somehow, it can't represent the high school. So he decided to do it to another classroom. Got the identical response. So if we want to know, we adults in this room want to know what's happening to our children outside those doors. If we want to know, we can know. We can ask them, is this happening to you? And I can have a long conversation about how to do the survey, an appropriate way to do it. There are lots of things to think about, but we adults in the room need to know, because living in denial won't change anything. And you can imagine little Anna's score. She never took the ACEs survey. She didn't live long enough to be in a situation where she was given that survey. So this is why this is hard work for us, because this is our life we're talking about. It's my life. You know, when I scored 5 on this, I was shocked, because I knew my childhood was tough. That's what we call it. Guys would call it, I had a tough childhood. But I didn't look at it that way. So I called my twin sister, on the East Coast. And I said, could you do the survey? And I would just want to know what's going on here. Same kind of response, in that we grew up in a household with abuse and neglect. But had you asked me before I learned about ACEs if I grew up in a household with abuse and neglect, I would have just said it was just it was tough, really tough. So now we know what's going on out there. And trust me, I'm about to turn the corner with this talk, because we've spent a lot of time for 20 years since the advent of the original ACEs study. One moment, please. So are we good? All right. Out those doors. Because you also know what's happening in your own life. One moment. Oh, he said I bent it. I never touched this thing, all right? All right. So we're going to turn a corner here. I did want to stress the point that for 20 years we have known, since the adverse childhood study was done with 17,000 people. We knew then, when that report was published, that we were in trouble. So this is not new news. How many of you, raise your hand, is this the first time you're hearing about the term ACEs? Can you raise your hand if this is the first time you're hearing about it? All right, okay, all right, interesting. So 20 years ago, we as a nation were warned. And I can tell you the reaction to that publication. And by the way, they had recommendations. We really need to get in there and really need to get supports for our parents. We really need, especially home visitation, that has to be universal. Let's just make sure this doesn't happen. Those were all ignored. It just met with deafening silence. But now, 20 years later, that is not the way we're going to move forward. Certainly not in New Mexico. So Senator Soules met up with Republican Representative Gail Armstrong from Socorro County, who said, I am absolutely behind the idea of an institute that will be a technical assistance center that will support every county in following the recommendations of that book. So we had bipartisan support, which was very important, because this isn't a partisan issue. It doesn't matter what side of the aisle you sit on. Kids in crisis matter to everybody. And there are huge costs associated with this. So an epidemic of childhood trauma is not free. Arizona pays for an epidemic every single day. Your child welfare system and their overtime, your judges, your police departments, and of course, because ACEs can lead to substance misuse and mental health challenges, suddenly now all the systems get overburdened and additional problems start popping up. So now the workforce is in trouble. If you have an epidemic of trauma and adults have untreated trauma, these workers, they're going to be calling in sick a lot, absenteeism, and if they do show up, they're not ready to work. Lots of problems for the workforce. So if communities want to be a business-friendly community, they better think about an epidemic of childhood trauma, because it becomes an epidemic of family trauma, and then it's an epidemic impacting the workforce. And I should say that I was pleasantly surprised to be invited. I've talked to 2 Chamber of Commerces. In my field of work, public health and child welfare, I'm not invited to a Chamber of Commerce. So I gave one speech to 500 business people and another to 100, and they both said the same thing. The audience was interesting in that they didn't move at all during the talk. And I mean, they weren't on their cell phones, which nowadays is considered unbelievable. They just sat there, and I thought, am I reaching these people? But at the end of it, people coming up, I never knew this was going on. No one ever asked me to get involved. And what do you want me to do? So this is a problem for the public sector, and it's a problem for the private sector, which is why we've got to come together here. So people say, well, you want to have community supports. Like, that's good. Like, how do we know if we're there? Like, well, you're there when you've reached 100% of your children and your parents. If 100% of your children and parents can say to you, we can access mental health care when there's a crisis, then you've arrived. So the first step in my project that you're all about to start in this room is you assess. So we assessed the county, and we have a survey. It's in the back of the book of Anna, age 8, and it's extended now. We just asked parents and youth, to what degree do you have access to these 10 services? And they tell you. And in some counties, in Socorro County, they did the survey, and I'm watching the results. They've made pie charts, and every one is almost identical. 75% of the parents and youth say they cannot access or easily access these services. And I'm talking things like safe shelter and food. I mean, I think in the United States of America, really, hunger is existing here? I mean, that to me is incomprehensible with this much wealth. But my point is, I saw all 10 slides from Socorro County. All of them, about 75% don't have access. And one was like almost total access. And I was like, early childhood learning programs. And I said to them, what is it about early childhood learning programs that they do so well and the other ones are not? And the organizers of the event said, well, we as a community decided a while ago that everyone should have access to early childhood learning programs, so we all worked together to do that. I go, well, that's incredible. Could you just do the same thing in 9 other sectors? So it was really interesting. So again, I want to stress that there are 10 key services in this community or the communities you come from. If these services are robust and exist, all the bad stuff goes down, all the good stuff goes up. And by good stuff, families that function, schools where kids achieve, higher employment, a functioning society where everyone gets a chance to succeed. So think about the 10 services. There are 5 to survive and 5 to thrive. And we don't know to what degree in your communities you're exactly at, but we could sure find out pretty darn fast if you want to know. So when it comes to survival services, who thinks in the middle of an epidemic of childhood trauma that you might want to have behavioral health care? Do you think that's a luxury service? This is a survival service. So you need to know in your community to what degree can your families access this? Medical and dental care. Is this a luxury, or should in a country this wealthy somehow find a way to make sure everyone can access this? Now the good news is, in many communities in America, a lot of people have health insurance. Some people are on Medicaid, Medicare. So your pie chart may indicate that many people do have access. So that's great news. Maybe only 25% aren't quite doing it. So you just have to figure out, how does the private sector and the public sector come together and say, how do we make sure that 25% can access? Does that make sense? So you don't have to start and think, oh my gosh, in my community we have to like turn into Sweden. No, you don't have to turn into Sweden in terms of having these services already in place, because in many ways you have them already, but you need to know to what degree. And you need to know not only do they exist, but of what quality. And your survey that we can easily make available to you and easily implement can be done very, very quickly if you want to know. Safe and stable housing, healthy food systems, transportation. You folks are like me in that we live in places where if you don't have a car, how are you going to do? I got to your Sholo airport and I looked for Uber. And I'm still waiting for my Uber ride here. It's not quite there yet. I know it's coming. I know it's coming. But these are the survival services. And there is no excuse in America today that we cannot provide this. Because we've already done a lot of the work to make sure that 100% of our kids and parents and grandparents who are caring for our kids have access to services. Because if we don't, we stay in a place called the status quo. And I spent the first 20 minutes telling you what the status quo is here, because I know what it is here, because it's the same everywhere. And remember, ACEs is not something for the other side of town. ACEs transcends socioeconomic class. So think of the wealthiest neighborhood in your community right now. Just envision those beautiful homes. They look really nice, and you could just think, life must be swell there. Don't think that for a second. Horrendous things happen in very wealthy households, at middle-class households, everywhere. The wealthier do a much better job of keeping that a secret. We all work to keep it a secret, but the wealthy and the middle class can usually stay out of the newspapers. Lower income people, not so much. We want family-centered community schools, and you may be saying, well, what does that mean? Well, in an epidemic of childhood trauma, where the children gather 5 days a week, you're going to want a school-based wellness center. And that school-based wellness center is going to have behavioral health care. If not, good navigators to take you to medical care and dental care. And these models are everywhere. Every state has full-service community schools. They're fantastic. They have extra staffing. They have the funding for extra staffing to be able to have navigators to help parents find their way through the system. They have extra tutors for kids with high ACEs scores. They do amazing work. And if you want research on this, just type in community schools. You'll be overwhelmed by what they will do for your kids and families. Early childhood learning programs, tons of research here. And I'm going fast. The point is, every sector I'm showing you, and there are 10, have decades of research behind the value. There's a field of study that looks at something called the social determinants of health. And basically it's just what determines your health? It's the services that you have in your community. Either help you become resilient or possibly curse you to a life of absolute hopelessness and despair. Youth mentorship. Big Brothers Big Sisters is considered the gold standard in this, though there are many wonderful mentorship programs. And this is really interesting. Tons of research that will tell you, strongly indicate, that a child who can get a big brother or a big sister will do so much better in school, will delay alcohol use, drug use, parenting. All the good stuff goes up, all the bad stuff goes down with big brothers, big sisters. So the question would be, in my community, do we have that? If you're like New Mexico, some do, some don't. In some, they can't recruit men. The men will not volunteer. The men will not give up basically an hour and a half every other Saturday for a year. They won't do it. The women will. In Santa Fe, big sisters, they'll go in gangbusters. 120 waiting for a big brother in Santa Fe. And Santa Fe is a very wealthy, parts of it are very wealthy, with a lot of retired gray-haired people who look a lot like me with time on their hands. But they won't volunteer to help the boys of the community. And I'm always really struck by that. Like, what's that all about? What is it about us guys that we don't do that? I think there's something, that's a conversation to have, because that shouldn't be happening. I think it goes back to trauma. I think it goes back to just hard stuff. And we guys are like, it's the last thing I'm going to do is be with a kid who might have some issues, and I have to kind of be around that. But we also know there are ways to make that happen. And you're going to be working on that in just a moment. But this is low-hanging fruit. We don't need to build a building in your county to get this going. But we do need strategies. How do we recruit? How do we get the guys in? What are the other models? Parent supports, this comes in the form of home visitation. The moment the child is born, there's someone like nurse-family partnership that was mentioned earlier by our doctor. Tons of research behind that. Like, you reduce bad stuff and you get good stuff. Many ways to do home visitation, also respite care, and lots of parent education, which now can go online. So there are lots of ways to innovate in this area too. And job training in higher ed. Our parents need jobs and they need training. Most parents want to provide for their kids. And we have to do a much better job of providing that training, in person, online, both. We have to make sure that our education system is in alignment with the job market. Let's not train people for jobs that won't exist, because we know what jobs are going to exist tomorrow and in 5 years. And that's why we were really excited to be part of the college, because Dr. Bailey is all about alignment. But he's also about acknowledging the trauma that his students have that will keep them from ever really fully getting the training they need. But there's so much opportunity here too. So I'm about to wind down and we're about to get interactive. And I know what I'm explaining to you maybe, I don't know, it may be too much or too complicated, or how could we ever do it, or what the heck is this guy really talking about? Or you might be thinking, I kind of like this, but how do I explain this to anyone not in this room? It's simple. 10 sectors at 100%. 100% of our families get access to 10 sectors. How complicated is that, really? 10 at 100%. And as I said, for many of you, your communities may already be at 90% or 70%. So it doesn't mean tons of work, or it might. The point is, that's the work ahead. Now you could say, well, all well and good, but there are a lot of reasons why we can't do that. And that's the choice you adults in this room have to make. Because it's you adults in this room, quite honestly, that are going to decide the fate of the Annas and the Andrews who are outside that door. You keep doing what you're doing, and you'll have the same rates of ACEs, the same rates of abuse, the same rates of all the bad stuff. Or you do something very, very different. And by the way, I'm not suggesting you people who are the champions, you've come out, you aren't doing this work. I know you are. It's that we have to work in a very strategic way, a very data-driven way, a very cross-sector way, and we must work in alignment. Because if you're already doing great work here in one sector, we don't replicate that. We know what you're doing, we support what you're doing, and maybe we boost other parts of that sector. Does that make sense? Alignment. In the private sector, if you're a business person, you're all out of alignment. You don't repeat. You go where you need to go. So we need our private sector thinking here as well. So what we have in New Mexico that I offer to you in Arizona is what we call the 100% Community Initiative. And it really is almost as simple as, on a county level, or a community level that you feel makes sense, whatever that community may be, that you make a commitment to bring together people who work in these 10 sectors, and you form 10 action teams. And these aren't task forces who sit around and ponder the problem and maybe make recommendations. They're called action teams. They look at the problem, they assess the problem, they make a plan with logic, they implement in alignment, and they evaluate. It's called continuous quality improvement. It's a 4-part cycle that just circles through. You're always improving every sector in alignment. And we will be starting that July 1st. So Dr. Courtney and I become the co-directors of the Anna Age 8 Institute. And we have 3 pilot sites: Doñana County, Rio Arriba County, and Socorro County. We had thought, because we live in Santa Fe, Catherine and I live there, we thought, well, Santa Fe will be the first county that comes on board. So I met with their newly elected mayor, a man I deeply respect, very well read, really knows his stuff, comes from the private sector. And we had a latte lunch. Latte lunch? We're just sitting there having 7 lattes. Maybe we had a few. And he said, Dom, love the book. Here's my endorsement quote. You know, I agree with everything you've said. This should all happen. He goes, but Dom, I've just been elected mayor, and I need to let you know something. The way government is set up today, we're not really set up to kind of oversee what you're talking about. As much as I think that should happen. You know, the city isn't over these sectors. And so we had a really good conversation. And I said to him, I go, you know what? I understand that today, city government, county government, school board government, state government, you're not set up to do what I'm saying today. But that's called the present. I'm talking about the future. Can we change what government does, working in collaboration with the private sector to get where we want to go? So part of your job, if you choose to take on this initiative, is to talk to your elected officials, many of whom are in this very room, and say, is there a way that our governments could support this kind of work? Obviously with our nonprofits and all our other partners. So again, 10 action teams, and it's really, you're developing change initiatives. You're going to be working an action team, and you're going to see like, wow, in the food sector, you know, we have a great food bank. As a matter of fact, it's fantastic. It's doing so great, you know. So 2 days a week, it's doing super. Well, what about the other day? Well, they can't be open those days. Well, could it be open those days? No, they don't have the funding. Well, could we meet and talk? Could we bring in Starbucks? I mean, this is the thinking we need, because I can tell you, with you in this room and the people you know, you can fix every sector. It's not brain surgery, but it does require focus. And it requires all of you sharing with one another your great ideas. One other thing to think about, what we're going to be working on is where do our action teams meet? Like really, physically, where do these people meet? Like where's a good environment to be sitting in? Should you be in a second floor, 2 floors down basement with bad lighting and no water, where I worked for many years in child welfare? That's not the environment you want to be in. Can we not create what the business sector does? Create incubator spaces, innovation spaces, right? Where we think about startups and think differently. We need to create a spot where you can all meet and come together. And you can bring young people in. Because I tell you, some high school people will tell you exactly how to fix some things. So this is a way for you, for us, to bring in all the generations. Our grandparents, the parents, the teens, bring them together, the private sector, the public sector. So what I'm talking about has not been done yet, by the way. What we've done for 20 years is there have been very noble people wanting to do things, and more than things, but we've been in silos. We work in one sector over here, a foundation funds one sector to do something for 3 years, goes away. We can't work like that anymore. This has to become institutionalized. So eventually one day, your city will have a department of, well, they already have a fire department, they already have a police department and a parks department. Can't they have a Department of Family Resilience that oversees this process to make sure? And it's not that the city has to do all this, they just assess and make sure it's happening. Can't the county have a similar department? Can't the school district also have one? This is where we can get in 5 years. If you people in this room decide that you want to change the future. Ultimately, it's as simple as this. Either we in this room, we adults, decide that all our kids get a chance to succeed, or only some of them do. And this is where you have to do some soul searching here. Because really it comes down to this question. What percent of your children in this community deserve a chance to succeed? 10%? 20%? If we get to 60%, is that enough for you? 60% of our kids get a chance, and we're kind of sorry about the 40, but as they say in some counties where I talk, you know, those parents, they don't really deserve our help. They're not deserving. I hear that all the time. I'm happy to talk with anyone about what parents deserve or don't deserve, But to me, that's not about the parents. What do the kids deserve? Let's separate those two. And trust me, there are some parents that I would question too, like, I don't know if I'm going to invest in anything that helps them. They don't seem to really deserve it. But really, Anna's mother, in the book we call her Cassandra, we don't call her a monster. They called her a monster in the newspapers and on the news, and I mean for months. The monster. There was a group that formed. They were so upset with this death, they wanted to reinstate the death penalty to kill Cassandra. Think about it. Parents do monstrous things, very monstrous things, but they're not monsters, because the moment we start pointing fingers is the moment we don't have to take responsibility. Because let me tell you, Cassandra was once 8 years old, and you can imagine what her life was like. So all that said, we have an incredible opportunity here in this room at this moment to change the course of this county and your neighboring counties. If that's where we want to go, if you want to join this, you can. And if you don't, you don't. I think that if New Mexico, and I mean New Mexico is rated by the Kids Count report from the Anna E. Casey Foundation, we are rated the most unsafe state to be a child. 50th, we got 50th. Took a lot of work to get there. 47th, 48th, 49th, New Mexico's never been out. But New Mexico, just a few months ago decided, with a new governor and new leaders and new county leaders, they came together, they rallied around a little book that couldn't get published. And they read it, and they said, enough is enough. New Mexico is going to commit to this. We're going to make an institute. We're going to get behind this and work in all counties. We will customize this process for every county. It won't look the same in every one, but we're going to do it. And let me tell you, if New Mexico has done this, Arizona can absolutely do this. So what I'd like to do is stop talking and do a little doing. And I know you guys probably want a little break. So I think what I'd like to do is I'm going to stop talking. I'd like to pitch is a 5-minute break okay? 5-ish? Is that all right? I want you to come back, and then we have a little work to do. It's going to be creative. So I want to thank you for listening, and I'll see you in 5 minutes. Thank you very much.